Hi, I'm Dr. Cara, a veterinarian and the host of the Pause and Effect podcast. Over the past 2 years, this podcast has been a platform for meaningful conversations about the care and the well-being of our pets. I've been fortunate to speak with incredible experts like Dr. Peter Hanekom, Dr. Nikki Hogan, Dr. Fossum, Dr. Nick Sturck, and all of whom have shared their expertise on chronic illnesses, emergency care, and just so much more. In this special highlight series, I'm sharing some of my favorite moments from these episodes, offering insights into how we as pet owners can recognize, prevent, and manage health issues to give our pets the best quality of life. Regular checkups are vital for detecting issues early, allowing for timely interventions that can improve your pet's quality of life.
We are able to be more proactive about slowing the progression. Unfortunately, once an animal has chronic kidney disease, there's a very small percentage of cases when like an acute renal disease, but on the majority, you can't fix it.
So there's no regenerative capacity?
No. Once those nephrons, which are the individual bits and pieces inside the kidney, once they're gone, they're gone. We can't get them back. And unfortunately, we only traditionally have picked it up quite late in the disease. The nephrons that are still functioning, they almost sort of hypertrophy or get bigger and take on more work for the ones that aren't working. So by the time you see changes, whether it's in the animal's behavior or on the blood results, you've got anywhere between 65 and 75% of the functional mass of the kidneys gone.
Pets often communicate through subtle changes in behavior or routine. Understanding these signs can help us catch health issues early. These are the clues your pet may be giving to indicate that they have a heart condition and why you should not ignore it.
Cats are very, very good at hiding that there's something wrong with them. And so they often have heart disease without anybody knowing about it until they have a sudden cardiac event. And that usually is going to be fluid that develops in the lungs or outside the lungs in the thoracic cavity, and then they're going to develop severe breathing issues. I'll say severe, it could even be mild sometimes, and if you're a good owner, you might pick up on that, but often it's picked up when it's already severe and they're battling to breathe, or they may have thrown a clot, which is a complication of cat heart disease, in which they can come in being paralyzed in the hind legs, and then you might find, whoa, why are we breathing a little bit faster than what's normal?
And people, I suppose, attribute that to various other things.
Yeah, they might think it's unrelated, they may not make a connection.
Cats are absolute maestros at hiding clinical symptoms and appearing to be normal on the outside, and they sort of cope, and then all of a sudden the wheels come off, and often owners will be like, but he was absolutely fine last week and now he's vomiting everywhere and he won't eat and he's lost so much weight, and they perceive it as this massive, very quick decline. But I always explain to people that it's actually an exhaustion of those compensatory mechanisms. They go into that compensatory phase where they look outwardly normal, they're still eating, but eventually they run out of those compensatory mechanisms, and then they have this, what we call an acute decompensation, and they just tank.
Because they are a lot more subtle with their illnesses and their emotional well-being, I really want to encourage you to take your cat to the vet once a year, and when they get older, maybe even every 6 months, because cats are notorious for hiding their illnesses and only really showing themselves to be sick when they're really bad. But if we doing those annual checkups and asking those questions and doing that clinical exam, we can pick up things early and we can help our cats age well, and then it can be a really good old age. I always say getting old is not a disease. It's part of life, but we can help our pets age gracefully and comfortably so that they continue to enjoy us and we can continue to enjoy them.
Long-term health management is about building routines that work for both you and your pet, ensuring that they thrive for as long as possible.
There's a specific ratio of the omega-6 and 3 fatty acid, which has been clinically proven to be anti-inflammatory. The ingredients chondroitin and glucosamine, they're being added in for cartilage integrity, for example. So even though it is a very, very focused diet, your dog is not being deprived of any nutrients. So in that respect, yes, joint diets and even weight diets can actually come hand in hand with each other, but that's where you need to then speak to your vet about it. Because if you have, for example, a ridgeback that's got joint pain but has got an ideal body condition score, you don't want them to lose any weight, because then they're going to be losing their lean muscle mass, which they need for the strength of the joints as well.
Emergencies is something we hope never to face, but being prepared can make all the difference for our pet's well-being.
Phoning in for advice is always important. So if you've got a dog that is bleeding, the best thing to do is to put pressure on the wound and, try and control that bleed on your way in. Even if you are rushing in, to get on the phone, and if there's things you can do on the way or, before you come. And I often find, especially as we said earlier with a seizuring case, people rush in, by the time they've arrived, the animal's it's up and around, wagging its tail, and then I have to go through, now we can start the diagnostic steps. But in that case, it might have been safer for the dog to have finished seizuring, have me on the line, and then I could have spoken them through it, because not every dog is going to seize persistently. So it is important to just sort of communicate with your vet.
If any of the advice resonates with you, I encourage you to listen to the full episodes available on your preferred podcast platform. Your support, whether through reviews, shares, or simply listening, keeps this podcast going. Thank you for being part of this journey.